Under general anesthesia, the patient was placed in a lateral decubitus position in a beanbag. The arthroscope was in the posterior portal, and the working portal was the standard anterior portal just behind the biceps tendon. In the glenohumeral joint, the status of the torn articular side rotator cuff was inspected, and torn edges of the rotator cuff tendon were gently debrided to aid in mobilization of the tissues. And then previous threads of the suture anchors were removed, and any adhesions to the surrounding tissue was released. Initially, tear depth and location was measured by calibrated probe, and mobilization was attempted such that torn articular side rotator cuff reached the greater tuberosity. Using the shaver or burr, exposed footprint of the torn supraspinatus tendon or the greater tuberosity was debrided, and a suture anchor was inserted at the articular margin of the humeral head. All the 4 strands which were attached to a suture anchor were retrieved through the anterior portal. All 4 threads of the anchor were passed sequentially through the torn rotator cuff as per the transtendon technique. Next, each strand of the suture anchor was made to penetrate through the biceps tendon using a bird beak suture passer. Consequently, the anchor strands were retrieved through the anterior portal. And again, an 18-gauge spinal needle was reinserted in the tear margin of the rotator cuff, and a non-observable suture was used to shuttle the suture limb. As a result, the 4 strands in the anterior portal that previously penetrated the biceps tendon were repassed to the rotator cuff. Next, the insertion of the biceps tendon was cut with an arthro wand, and the arthroscope was subsequently moved to the subacromial space, where each 2 strands of retrieved 4 strands were tied consecutively. The lateral row repair of the suture bridge repair was performed using lateral raw anchors. The arthroscope was then moved to the glenohumeral joint to confirm the integrity of the repair and incorporation of the biceps tendon at the site of repair. In the glenohumeral joint, biceps tendon was located between torn articular side of the rotator cuff and exposed greater tuberosity bone.